I just wanted to give a quick overview of where we are and just a few notes for some urgent priorities. I know Dr. Lawler always starts with a movie, and I think he's actually already started with this movie, but I'm going to start with it again anyway. It feels a little bit like Groundhog Day right now, just looking at where we are in readiness for a new pathogen, a novel pathogen in a lot of parts of the world. Not a new pathogen by any means, but a pathogen we weren't necessarily prepared to see in the US and in many places abroad. So just as a reminder, monkeypox is an orthopox virus related to smallpox. It is less deadly than smallpox, and the mortality is about 1 in 10 people with symptoms. One of the challenges with this virus is that the incubation period is 6 to 13 days, but can range much more broadly from 5 to 21 days and sometimes out even a bit longer, which makes understanding where we are in the generation of this outbreak a little bit challenging, especially since we're still in the case ascertainment space, so to speak. The illness starts to begin with nonspecific symptoms, and you can be well into the to your case before you start to see the lesions like are in the image over on the right side. You will see fever, headache, body aches, and swelling of the lymph nodes. I've put a couple links here in the bottom of the slides that give a little bit more information on what cases can potentially look like and where we are, generally speaking, in this in the current outbreak. So this is a map. Of course, every outbreak seems to come with a map now. So here's where we are in the global picture, and I've linked to this map on the next screen. This includes suspect and confirmed cases across the globe. So globally, we're at 614 suspected cases and 558 confirmed cases, with 36 countries reporting confirmed or suspect cases. And the links to both the originating data and the map that was just shown are at the bottom of this slide. And I would expect these numbers to jump substantially given the weekend that we're just coming off of, and in the US, a long weekend as well. We know that weekends can be challenging across the globe for case reporting. The US is reporting 15 confirmed cases, and you can see where they fall across the map there. The asterisk is because this includes confirmed cases from the CDC and from our laboratory response network partners who can confirm orthopox virus, and that makes for presumptive positive cases, which then go to the CDC to be confirmed for monkeypox. I wanted to share where we are with the global risk assessment of this outbreak. It's growing quite rapidly, and I think this gives everyone space for concern, and especially given the already stretched incredibly thin resources that are going into managing the COVID-19 pandemic. So the World Health Organization has put the risk at moderate. You can see the quote there. They do note that if we do not stop local transmission as soon as possible, that the risk will grow to high, especially given the waning vaccine levels across the world from smallpox. For the US CDC, they're still classifying the risk as low. Frankly, my view would be to lean towards the World Health Organization's moderate classification, but seeking medical care immediately if you develop new or unexplained skin rash, lesions on any part of the body. And they do note that if possible, they're asking people to call ahead before going to a healthcare facility. And I think one of the reasons for this is that screening is still being stood up, and management of these cases is still being stood up. We want to push our healthcare facilities to get back to our roots of identify, isolate, and inform, which is critical in these cases. But we are still in a place where hospitals and healthcare systems across the world, and certainly in the United States, are still overwhelmed with surge, both from the COVID-19 pandemic and people returning to hospitals. So just a few urgent priorities that I noted. We're still very much in experiencing challenges with case ascertainment, and so we will see these cases growing in reporting. There's been a lot of talk sort of on social media and out in the public around doubling rates, and I think right now, because we are still identifying cases and not seeing them just naturally occurring, but looking through case reports and testing samples that already exist, and the fact that there is an inconsistent case definition from country to country, that we will still see a rapid increase in case identification early in this outbreak. A couple of things to note: the CDC case definition is at the link right there, but there has been some concern that it is challenging to navigate, especially for frontline providers, quite long and a little hard to manage. So I think this is a place where we could see some refinement over the next couple of weeks from the CDC. And one of the things that makes case ascertainment really challenging is that there's no case report form on the CDC website. So we've expressed through NETEC and some of our colleagues a real urgent need to have a case report form available to all of our healthcare and public health practitioners urgently. And so we're waiting to see where that goes. As far as testing goes, so the Laboratory Response Network can do orthopox testing for presumptive positive. So they will get a confirmatory orthopox diagnosis. At the same time, the CDC will conduct their confirmatory monkeypox testing, but their message to all of our laboratory practitioners is that orthopox positive should be assumed positive for monkeypox testing in the United States. There is no commercially available assay, and this is what the lab process looks like broadly for monkeypox testing in the United States. So the patient's evaluated by a healthcare provider. That healthcare provider uses the CDC case definition and consults with the health department, who consults with the CDC EOC. Their samples are split and then tested at a laboratory response network and also sent to CDC for characterization. And so if they're orthopox positive at the LRN, they are presumed positive even as the CDC results come in. For medical countermeasures, the options are on this slide here. So for pre-exposure prophylaxis, which we are currently working on across the NETEC network, so across the country with the support of the CDC. We have JYNNEOS, which is an FDA-approved vaccine for monkeypox, and the MMWR on JYNNEOS for both pre and post-exposure just came out on Friday. I've linked to that at the end of the slides. And then ACAM 2000, which is approved for smallpox and is under IND for monkeypox. There is also post-exposure prophylaxis through ACAM 2000, and the MMWR notes the requirements for use of JYNNEOS, which is a 2-dose vaccine for post-exposure prophylaxis. Treatment options are listed here. The priority treatment is TPOXX. So it was FDA approved in 2018 for smallpox. It can be accessed through the CDC EOC. They have doses in the Strategic National Stockpile. So it's under expanded access IND for monkeypox, but can be accessed, it can be used off-label, and then the CDC is currently building a data collection tool to be used, protocol for the IND for tecovirimat. Two other options for smallpox: variable availability, and per CDC, tecovirimat is the priority treatment. So just a couple of additional resources here on our NETEC site. We have a few blogs on what the current situation is in the United States, the EMS priorities, thanks to a colleague of ours at Emory, and then waste management, which can be a challenging subject for monkeypox, given that the way we manage waste depends on the clade. We're presuming, based on the CDC testing, that all of the cases in the United States are of the West African clade, which does not require Category A handling of waste. And then just a few more links here. So the top two links are just overview on the current outbreak and priority messaging around monkeypox, including a sign up to the COCA calls if you're interested. The WHO website has all of their monkeypox material categorized. The exposure questionnaire is this link, this fourth link here. And then this last link is the MMWR for JYNNEOS. So I think, and then yes, the CDC just updated their travel advisory notices to a level 2 take precautions. So you can see that travel advisory notice here on that last link. And Shelley, with that, I'll hand it back to you.